Hi, Miss Harris. How are you today?
I'm fine, thank you.
My name is Chris Bray, and I'm a family nurse practitioner student working with Dr. Jones. While he sees another patient, would you mind if I did your exam?
No, that'd be fine.
Okay. I'm going to start out with just looking at your hands. I'm going to check the capillary response. Do you have any problems with your joints?
No.
Nothing particularly bothers you?
No.
Okay. Ooh, there's some popping in there.
Tennis.
Tennis, is that what it is?
Yeah.
Okay, if you'll put your fingers out, don't let me close them. And wrist. Okay, you'll press up with just your hand, press down. Okay. And then I'll check your arms in a minute. Okay. And it's a pretty wedding ring, engagement ring. It looks new. How long have you been married?
10 years.
Well, it's clean then.
Yes.
You're taking care of it. No problem with that? Okay. No tennis elbow.
Not on this side. Right-handed.
This, ooh,
Maybe
does
I'm
that
just
shoulder hurt?
maybe I'm just old.
I don't think so. Okay, now let's do this straight. Okay, now squeeze both hands tight. Okay. Push up, push down. Now, push out, pull in. Strong, push out, pull in. Shrug your shoulders. Okay, now, if you'll put your hands above your head, behind your head, and behind your waist. Okay, and do that again with my putting my hands on your shoulders.
Did you do everything right?
Yes, you did. This shoulder is much worse than this one. Does it give you any problems?
No. No,
Okay.
not really.
I'm going to give you 3 words, and I will see if you can remember those when we finish the exam.
Okay.
Okay. Apple, box, and cat.
Okay.
Okay?
Apple, box, and cat.
Okay.
Okay.
Now I'm going to start with your head. I'd like to look at your hair and look at your scalp. Your hair is so nice and smooth. Does anything in your head hurt?
No.
Good. Okay. And if you'll put your head down and back to the side, to the other side, into your ear down, and your other ear down. I didn't hear any popping.
No.
No. Okay. Let's start with your ears. Look at your ears and how they're placed on your head. Okay, so let me come over here first. Does this hurt?
No.
Okay. Look behind your ear. Palpate the mastoid. Do the same thing over here. Over your ear. Behind your ear. Okay, get the otoscope. Okay, I'm going to look in the canal first. And then look in your ear canal. Sounds good. There we go. I didn't want the cord to come back and smash you. It's probably a textbook example of a clean ear, cool ear. No. Have you had problems with ear infections in the
No,
past?
I haven't.
Okay. Now I'm going to cover this ear. Whisper. 1, 2, 3.
1, 2, 3. ABC.
I'm going to make this ring and put it on the top of your head and tell me if you hear it in both ears equally or one better than the other.
Okay. I hear it equally.
Okay. Now I'm going to do the same thing, but I'm going to put it back here and just tell me when you no longer hear it.
Okay. Okay.
Can you still hear it?
Mm-hmm.
Okay. I'm going to do the same thing over here.
Okay.
Can you still hear it?
Yes.
I'm going to look at your eyes. First look at your eyebrows. And you close your eyes. Look at your eyelids. And look at your eyelashes. Okay. Now I'm going to just look at the. Okay, there. Conjunctiva, the sclera, the iris. Do you have any trouble with tearing?
Mm-mm. No.
It's on that side that tear duct looks a little bit red. I know that makes your eyes kind of blink.
Okay.
Okay. And then if you'll just look straight ahead, I'm going to look at your pupils. Okay. If you'll follow the tip of this all the way into your eye. Okay, great. That feels funny though, doesn't it?
It does.
it
Makes me
always does to
cross-eyed.
people. Okay, so now what I'd like you to do is follow the tip of my pen without moving your head. Okay. Take that. I'm not going to be able to see anything in here because the lights are on, but look at the back of your eye. These cords are very short.
Mm-hmm.
Okay. I'm going to have you look straight ahead, and I'm going to look for the red reflex. There we go. I am shocked. It's so easy to see, even in here.
It is usually.
I wonder why. I mean, usually with this, all the lights on, it's going to be hard to do. You're the perfect teacher for health assessment. they can see in your eye and in your ears.
I have big pupils.
You do, even with all the light going on. Okay. Go check your sinuses. Do you have any soreness up here?
No.
Soreness here?
No.
What about if I do this?
Nope.
No? Feel your nose. You ever had a broken nose?
Nope.
It doesn't feel like it. Okay. Let's get. is there a magic peel? If I looked at it, then it would be easier to see. Okay, just there you go. Lips. Mucous membranes. Palate. Gums. Teeth. Salivary glands. I tell you, you're just a perfect specimen to check. Okay, I'm just gonna have to look at your tongue on this side. Okay, I'm gonna look at tongue on this side. Now open up real wide, and I won't gag you since you're my boss. Say ah. Ah. So, I don't think that's a good thing to do to your boss.
I probably have garlic breath after eating Applebee's.
You didn't. Okay, if you'll turn your head against my hand. Turn your head against my hand. I want you to grit down. Okay, do it again. Great. Now, with your face, follow my expressions. That's hard. It's hard to do. Okay, and stick your tongue in your cheek. Don't let me push it in. Do the same thing over here. Okay, now stick your tongue straight out and go side to side. Okay. You're going to do calisthenics with it. Okay. Look at your neck. Usually there's lots of tension. Ooh, yes, there is some tension back there.
I wonder
I was
why.
gonna say, there usually is, and so I was going to comment on that. But. Okay, your trachea is midline, and your thyroid. Okay, bend your towards me just a little bit, and then down. If you can, swallow. Okay. I'm going to do the same thing with the other side. Okay, swallow. Okay. Now I'm going to do your lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular. We're going to go sternocleidomastoid, behind. Have you had sore throat?
Mm-mm.
His lymph nodes are just a little bit enlarged. That could be from something in the past. All clear. I always worry about these when I'm doing an exam because I have found breast cancer
Okay.
just with
From
that,
lymph nodes.
and that just, I always am a little hesitant. So, what I'm going to do now is to look at your back, and I'm going to just you sit calmly. I'm watching your breathing. Okay, now I'm going to put my hands on your back. I want you to take a deep breath. Okay, that's perfect. Okay, when I put my hand on your chest, I'd like you to say 99.
99. 99. 99. 99. 99. 99. 99.
One more.
99.
Whoops, let me get my hand in the right place. Okay,
99.
okay. Thank you. Now I'm going to, because it's always important to have the provider look at the apices, because that's the most common place for TB. And given some of the things that have been occurring in Texas, especially South Texas. It's important to always check for TB. Okay. Now I'm going to listen to your chest, and every time I put my stethoscope down, if you'll just take a breath in and out through your mouth.
Okay.
Okay? Your breath sounds are really clear, so I'm not going to do any of the adventitious sounds back
Okay.
there. Okay? So now I'd like you to just lay down on the table, and I'll pull. That's sort of the provider's job, is to pull out the table. So I just thought I would mention that.
I'm trying to be the provider.
I know you're trying to help me. Okay, if you'll just turn your head just a little bit to that side, let me look for your JVD. There's not any around to the other side. There's not any. Good. So then you might have to lean up just a little bit. Let me see if it'll go. Okay, there we go. Okay, and I'm going to do the same exam on your front, listening to your lungs, and then we'll go and do your cardiac system, okay? So if you get sleepy, just fall
Go
asleep
sleep.
if you want to. Okay, I'm going to palpate a little more. Okay. Now, I'm going to listen. Okay. And now I'm going to listen to your neck for your carotid pulses. You can turn over that way. Okay, and turn it this way. I always love it when there's nothing.
Yeah, I do too.
When you don't, when you don't hear anything, it just feels good. Okay, and I'm just looking at the pulses. Pulses where I'll listen. I don't see any palpable, I don't see any thrills, and I wasn't able to palpate any thrills earlier. So I'm going to listen, and I'm going to listen a long time. I listen longer than a lot of people do, so don't worry that I'm listening a long time. can hear lunch.
Mm-hmm.
Okay. Now, listen to your heart and listen to your aorta. I'm going to check your pulses. Compare them. Check your inguinal pulse, femoral pulses. Popliteal pulses. Okay, they're all good. One other thing I want to check is to listen to your apical pulse while I do your radial pulse. I could have done that while you were earlier, but forgot. Now, do you mind if I pull your shorts down just a little bit? Okay, that's good. It's a borrowed stethoscope, so I always have to double check it. So I'm going to listen in all 4 quadrants. I'm going to listen over the arteries. And listen over here. Okay. And move my hand gently. You tell me if there's anything that bothers you.
Okay.
You're not reacting, so.
Nope.
Okay, it's a little deeper.
You should not have eaten lasagna.
That was not a good lunch choice, was it? I could actually hear it, but you know.
Bad.
Okay. Now I'm going to percuss. It's funny when just recently have I gotten nails.
Oh.
And so I'm having to learn to not kill myself with the percussion. Oh, there's your liver. I'm not going to be able to get the top of it. Maybe I will. Oh, there it is. Okay, I'm going to palpate for your liver. So just going to relax. Now take a deep breath. There it is. Did that hurt? Was that comfortable? Nice and smooth. Don't expect to hear anything with your spleen, but okay, I'm going to palpate for your spleen. Just relax. Okay, and take a deep breath. It's not enlarged at all. Okay, so we've got all of your abdomen done, so get your toes. Your toes are cold.
Yeah, they are.
I'm sorry.
I needed a pedicure too.
No, your toes look fine. this joint is a little bit red. Does that bother you?
I have a bunion.
Does it bother you much?
Some.
Well,
No high heel shoes anymore.
I was just going to say, I have had a bunion fixed, and I'd go a long time. just to give you that idea. Okay, palpate your joints and the skin. Your skin turgor's good. Your skin texture's good, and even though your toes are cold, the rest of you's warm. Okay. Anything else bothering you? Okay. So let's do some movement. I'm gonna do your movement first.
Okay.
That hurt? Okay. I got some there.
That's called snow skiing.
Oh my gosh. You must have had a very active family.
I did.
Okay. Now, if you'll raise, can you raise just one? You can bend your knee and then come up. I'm just feeling the joint.
Okay.
Okay, do the same thing over here. Okay, now I'm going to have you sit up. And what I want you to do is to push up with your feet, push down with your feet, push out with your legs. Okay, push towards me.
Oh.
And then back. Okay, and then out and in. Okay, any of that uncomfortable? Okay. Well, before I have you stand up, one thing I want to do is to check the reaction of your back and your kidneys.
Okay.
So tell me if this hurts.
No.
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 No. Okay. Now, is there hand sanitizer in here? Anywhere?
Around.
Put your hands beside you. Look straight ahead. Now, will you shut your eyes? Okay. Now, if you will walk up there about 10 feet. Oh, okay. That's good. Now turn around and, wait. And come up heel to toe. But look at me.
I'm cracking and popping.
7. It has to be at least 7 steps. Okay, now turn around, and I want you to just look at your back. Okay, now will you lean forward and almost touch your toes? Okay, good. Okay, stand back up. Now what I'd like you to do is to turn, leaving your hips still, turn to the right and then to the left. And lean forward and lean back. Now tip to the right and tip to the left. Okay. Any of that was uncomfortable?
No.
Okay. You'll sit up here. Now, we're going to do a couple finger movement tests. So if you take your finger out here and come to your nose as fast as you can. Now shut your eyes. Okay, let's do the same thing on the other side. Now there you go. You knew what to do. Okay, now do pretty fast. Okay, good. Now what I'd like you to do is to take this heel, put it on this knee and run it all the way off your foot, but look at me. Okay, now do the other leg. Okay, good. Now I want to check your reflexes. So first, now you let me carry your arm.
Okay.
I really am strong. Okay, let go of your arm.
Okay.
There, I got it.
There we go. A little bit.
Look off to the side. Relax. Relax your arm. Okay. Let's do this side. There you go. Make your arm heavy. That one's just a little bit. You can see that. Feel. Could you feel
A little
anything?
bit.
Okay. Just relax.
That one worked.
Those, your biceps are both really good. Relax your arm. Brachioradius. There we go. I could feel that one. Okay. If you'll make your legs just still, we'll do this.
That's a big
That
one.
was a much bigger. Okay, let's do that here. No, let your foot down. There. No, let me do it. There. You gotta let your leg go. There we go. Your Achilles are there. This one's better. Okay, I'm gonna relax your foot. It's just as there we go. Okay, just have your foot. Okay. Now, what were those 3 words that I asked you to remember at the very beginning?
Apple, box, and cat.
Okay. Apple, box, and cat. Okay, you got that. Do you have any questions for me?
No.
Okay, let me go check Dr. Jones's form, make sure I've covered everything, and then I'll get back to you.
Okay.
I see that I didn't ask you a couple questions,
Okay.
and they relate to things that have happened. What did you have for dinner last night?
What did I have? Chicken. Chicken and broccoli. And
Healthier than lunch with lasagna.
yes,
Okay.
most definitely.
Okay. And do you remember where you went to elementary school?
I do. I went to Waller Elementary.
Okay. And where did you go to graduate school?
I went to Chatham University.
That's all I needed was just some questions related to orientation of place. I mean, recent and past memory. I could also ask you, do you know what day today is?
September the 9th? 10th.
Or 10th? 10th. It's good. Or 10th.
Or 10th.
And where are we?
At the School of Nursing in the Assessment Lab.
And where did we have lunch today?
We had Napoli's.
And time. Person.
Do I know who I am?
Do you know who I am?
Yes, Chris Bray.
Okay. I had to think, what were those 3 things? That's